If you're over 65 and on Medicare and paying for Medicare supplement insurance, you're going to want to hear this. Now, what we're talking about today is Medicare supplement insurance. And they go by the letters A, B, C, D, and so on. And the most popular plans, at least for our customers, are the Plan G and the Plan F. And so what we're talking about today is, in the state of Georgia, we've got a 75-year-old female that lives in Georgia that enjoys the household discount. These are the prices for Plan G and for Plan F. And what I want to call your attention to is these are the 8 largest companies or that write the most business in the state of Georgia. Mutual of Omaha for a Plan G at age 75 charges $128.48 a month. If you go here with United American, the most expensive one on the sheet is $281 a month. What I want to call your attention to is these are the same Plan G. The benefits that this person could get for $128 a month or $281 a month or somewhere in between, they're exactly the same. This is the same policy, and it's really just shocking. Now, we're going to get back to this in a second. It would really be inappropriate to spend too much time on Medicare supplement without a good understanding of Medicare. Now, Medicare has 4 parts to it. Basic Medicare that you have with the government is Part A is your hospitalization coverage. And most of you signed up for Part A when you were turning 65 or when you were 65 years old. And you don't pay a premium for Part A. You paid your taxes throughout your life. And that covers your hospital and skilled nursing. Part B is your doctor and outpatient. And many of you signed up for this when you turned 65, but some of you delayed because you worked past 65 and you were covered under group insurance and you signed up for Part B at a later date. Now, that covers your doctor and outpatient, and it covers it at 80%. And you pay a premium of $144.60 that most people have deducted from their Social Security check. Doesn't have to be, but most folks, that's how they pay the premium to the government for Part B. And if you're a high-income person, you're subject to this IRMA, income-related monthly adjustment amount. And we're not going to get into that on this video, but if you have a problem with that, you're concerned about, we're certified financial planners, CFPs here at Cardinal. We can help you perhaps do some things with your income to affect that and perhaps get an exception for it. Part C of Medicare, unless you're enrolled in a Part C plan, which is sometimes called Medicare Advantage, this doesn't really affect you, okay? And what Part C is it's really the government outsourcing Medicare. So in other words, instead of giving you your benefits under Part A and Part B directly, what they're doing is it's privatized. And so a company like Humana or Aetna or Blue Cross or United Healthcare AARP, they are taking on your Medicare by your election, and you get your Part A and your Part B or your hospital and doctor coverage from the private insurance company. And the disadvantage to this, of course, is you have to use their doctors and their hospitals. And if you're on Part C and a Medicare Advantage, you can't get a Medicare supplement. So you don't have both of these things. So when we're talking about this doesn't necessarily apply to you. What does apply to you is if you want to get off of a Part C or you want to change to another Part C plan, you have to wait till the fall of the year. And then that's called the annual enrollment period. We can help you with that. You may want to get in touch with us now so we can just get you on our queue and our list so that we can talk then. And then Part D of Medicare is your prescription drugs. Okay, and that's, again, you have to wait till the fall of the year to make changes. We write these plans for most of our customers that carry Medicare Supplement with us. Now, if we want to get back to the Medicare Supplement, which what this video is about, is a lot of folks stay with their Medicare Supplement policy, the same one that they had ever since they were 65, because it pays well. And that could be the situation many of you are in. I just want to call your attention to, if you're 3, 4, 5 years, 2 years in, 10 years in to a supplement, and you're paying, up to $200 a month, $250 a month, and you've got Plan G or Plan F or some other plan, and you're paying that kind of premium, you may want to take a look at changing companies. So you can get identical benefits just with a different name of an insurance company on the thing, and you can save some substantial money. And it's just shocking to me that, like if you just use a different example, then Aetna can offer a policy with identical benefits for $135.18. And that, it's identical to USAA that's $189.38. I mean, that they're charging $50 a month more, $60 a month more for exactly the same thing. So you could work this to your advantage. Now, I got these premiums and these numbers off these rate calculation sheets. We can run one of these at your age, or you can go run it yourself at our website, which is cardinalguide.com. You can go to the Medicare page, and there's a calculator on there where you punch in your zip code, your age, whether you smoke or not, and plug it in, and that you're interested in a Plan G, and it'll give you your premium from about 40 different insurance companies and offer it. And we represent most of them. So this is what we do all day long, is move people around to get them the best rate that we possibly can. Now you'll notice that Plan F is up here as well, and I bet a lot of you folks really thought, and you had heard, that the Plan F was going away in 2020. Some of you may have even left your Plan F and gone to a Plan G or something else because you really went for that stuff. And guess what? The Plan F didn't go away. It's still available. If you're on one and you want to switch to a less expensive one, you can still do that. Even if you're not on one, maybe you left Plan F and you went to a Plan G and you'd really like to have it back, as long as you went on Medicare before 2020, which most of you did, you can switch and enroll for Plan F with any one of these companies, perhaps at a lower premium than you're paying now. So I want to call your attention to, we have a lot of other services that we offer at Cardinal, and I want to call your attention to long-term care insurance, and we have a very inexpensive offering that's going to take care of some nursing home and assisted living costs, as well as some home health care costs for as long as a couple of years. It's at a very affordable premium. We can talk to you about that. And we also offer life insurance up to $25,000 where you've got no health questions. So if you have some ailments that you think prevent you from getting additional life insurance, give us a call or send in that thing, and we'll sit down and we can price that for you. I'm Hans Scheil, and I thank you for listening.